Okay, so I'm Michael McSurdy. I'm CEO at Family and Children's Service. We're excited to have this chance to kind of talk with you guys about a program initiative that we actually started several years ago that fits really well with decreasing disparity and making counseling supports and mental health service supports available to folks really where they are. So we've adapted a presentation that we had. So it was about innovation at the time. And so, but we do think of a lot of what we do as being innovative because it's as much a shift in mindset as it is actual delivery. So it's not always about doing something radically different. It may be doing something in a different way. And so that's what we want to talk to as far as the our effort to bring health equity, mental health equity to folks. So as I said, we're an agency. We've been around for 75 years. Our mission is to connect individuals and families to hope, to healing, and to each other. Our roots are strongly in mental health services, adoption, and family supports. But through those 75 years, we've really expanded. We're also the Get Covered TN partner around the Affordable Care Act for the state with Health and Human Services. We have some SAMHSA funding. We kind of fill some gaps in service need as well over time. And so as we've evolved over time, we've grown. Our innovation, or what we think of as the means to overcome barriers for folks, is that we put clients in the community first, and then we put ourselves in the community with the clients. And what we believe is that by doing that, we're not just meeting the needs of clients. We believe that old adage that rising tides lift all ships. And so as we talk about this, we'll talk about some of our partners. And at another presentation we've done, the partners were actually there, and they talked about kind of that notion of what it means to have us in the building when the building is not a mental health facility, but what it means to have somebody there. So the other thing is that we feel like it's a pretty smart investment. So if we ask for $50,000, it's the return on that investment is about $40,000 more than that. So it's about a $90,000 value. Because what we've looked at is if folks who we kind of fell into this because people were asking us how we could help, and they were saying we can't hire somebody because it's going to cost us $100,000 to have a clinician. And I was like, I can give you a clinician for about $50,000 that will cover mental liability insurance, the supervision, all of that, and our folks are good. And what we realized was we wanted to make sure that if we put that person there, it wasn't a drive-by, that our staff, when they're at Connexion or they're at STEM Prep or they're at the police department or the domestic violence shelter, that they're really there. And so I was with the director for the domestic violence shelter yesterday, and she said, we think of Lane as our staff. And I said, then it works. She's supposed to be your staff. She's our staff for the purpose of we gather all the data, we provide clinical supervision. But if your staff doesn't see her as your staff, your clients aren't going to see her as available to them. So that's real important to us. And the value proposition is also important. It's also led to us being able to do this a lot of different places, a lot of different ways, with funding from multiple sources. So just coming back to us for a minute, we're a group of people. Of course, we're grounded in a place. Our new place will be right behind you on Clifton. We're really excited. They tell me that they will start moving dirt on Tuesday of next week. So I'm really excited about that. So, and we also have a shared set of beliefs about people, how they heal, what they need, and that what our responsibilities are both to them and to the community. And we know that we're stronger because as a group, our folks are very connected. People have different skill sets, different sets of expertise, and we really try to share that across the agency. I mean, for the past couple of years, we've really been working, as the whole city has, around trauma-informed care and ACEs, but we've really been working even through our HR, our administrative folks. What does it mean to be a trauma-informed agency? How do you talk about changing platforms? It's a big deal to people. We need to approach things the right way, and so we do try to do that. That's what the interactive arrows are. But then we also know that we're not alone in this work. There are a lot of people doing really important work, approaching it in some ways through the same portals that we approach it through the mental health portal, but also people are approaching it through education, through housing, through housing purchase assistance, through immigrant services, all of that. And so we really value our partners. So just to give you an example, at Department of Human Services, we have folks in 27 counties doing counseling with moms working to get off TANF. Well, their folks aren't clinicians. Our folks are. They're master's level clinicians, but they're right there where people have to come anyway, so they're more likely to take advantage of those services. Another example is Martha O'Brien. I think it's a great example because it is certainly a community. It is certainly a community that is also often felt very isolated. And at the same time, by putting someone there, it really challenged us because, we still come from the notion of, well, you come in, you do counseling, you leave. Well, that didn't work at Martha O'Brien because Susie may have a counseling session scheduled, but she got a call to go clean somebody's house and she can make $50 and she needs to do that and not go to her counseling session. We don't take appointments at Martha O'Brien. Winifred is there, she's just there. She sees more people than any other clinician on our team because it's just stop by. And she's not tied to an hour. It's like, if there aren't 50 people out there, then we might sit an hour. But if there are, it's like, can you stop back tomorrow? And, she works it out. And we adjust the model to the place and to the demands that people feel. At STEM Prep, we were asked to come in because they had community-based mental health folks there who came by, saw kids left. Kids would decompensate. Things would happen. They weren't coming back for 2 weeks. And so they said, well, how can you help? And I said, well, we would be here for one thing. And we'd also like to coordinate those services because we don't want to leave those resources on, leave them on the table and not take advantage of them because you have a lot of kids that they're not seeing because they don't have TennCare. So we see all the kids we need to see. We've kind of worked on changing the community-based mental health center model to say, no, you're going to be more engaged. You're going to come through us. We're going to know what's going on. And so now they were there like 2 days a week. Now they're there every day, and they're not putting kids on 2 and 3 week rotations. And we're seeing clients too. We have 3 clinicians, all Spanish speaking at STEM Prep, and they fund all 3 of those positions. It's worth it to them and their outcomes to have us there. And then Conexión is another great example. We have bicultural staff there, and we've really adjusted that model too because there are a lot of challenges for that community. And so that's been a really successful, and that right now we have support from the Healing Trust and HCA for folks at Conexión. And then the YWCA funds their position. We leverage VOCA money to be at Meharry and VOCA money to be at the police department and just a lot of other places too. So, but what we also know is by being there, it helps us. We become stronger. We increase our network and what we can offer to clients, both there, but all of our clients. So if someone's wondering something, they can call Teresa Baptiste at the Domestic Violence Division at the police department. We're stronger because she's there. We're stronger because Lane's at the domestic violence shelter, or if somebody's not having school success, well, we know STEM Prep works. Let's talk to the folks who are there. So that's always very helpful. And then with Meharry, we also have connections to, to medical staff and people like that when that's what our need is. We do some groups at Meharry at Elam for them, and they've let us come and do those groups for years. And then also what we found is the folks that we're benefiting from, what we've heard after having done this for a little over 4 years is they feel stronger too. They know each other in a different way because our staff are at all those places and we leverage those relationships. So, we have this clinical team. The majority of our partners are there, and some of these are formal partnerships where we have staff there. Some of those are places where we come in and do help. And not all of these are pure counseling. It may be enrolling people in healthcare. It may be relative caregiver outreach or other things that we do. And so we're connected to all those agencies in different ways. We also run 5 of the family resource centers based in some of the most under-resourced schools. And so they're good portals for access. And we put clinical interns there, so we're providing counseling in those schools as well. It's just a value add. So we feel like this model reduces barriers to mental health. And those are often, as you know, posed by poverty, language. We have a very large number of bicultural staff. Our agency team exactly mirrors the ethnicities of the folks we serve, which I've never, and it's kind of happened by mistake. We have 24 bicultural or bilingual staff out of a full-time staff of just under 100. So we are about 25% bicultural, bilingual. And that we also feel like, because, and we're trying to address this, transportation is a real issue, so going to where our clients are is really important. So current cross-sector partners, I kind of talked about those. Those were all on the picture as the infographic as well. These are the schools specifically, but we also partner with the other Family Resource Center schools and Family Resource Centers. You know, we're available to pencil should they need things as well. We do a lot of trauma debriefing when things happen. They'll call because we have language capacity. We can generally mobilize folks pretty quickly as well. So why we think it matters: it expands health equity by reducing barriers. We feel like it produces better outcomes for both us and the host agency. What they found is they're measuring, say, employability. Well, if you get your mental health needs met, you're likely to have better outcomes around employability, or school, like at STEM Prep. So we see those things benefiting both agencies. Strengthens both agencies. Often we pursue funding together, or that host agency can leverage funding we're bringing to the table, or we just support each other in funding asks. And also we bring different funders to the table. So like in the case of our work with Martha O'Brien and Conexión, actually Conexión goes for that money because they weren't getting funding from those foundations, but Martha O'Brien and Family and Children's were. So it allows us to further our reach clinically. It allows Conexión to get what they need, and they're not cannibalizing their funding resource because they weren't in the wheelhouse for the Baptist Healing Trust or for HCA, but suddenly by saying we want to provide counseling, they are. So they become a recipient of their funding. And then we also think it creates a more sustainable service model because it's cheaper, but also if we look at our counseling team, it's made up of probably 11 or 12 funding streams, leveraging federal dollars that flow through the state, leveraging Department of Mental Health money, and now coming to you guys to say, would you be a piece of this? It would really strengthen what we're doing. So why it's innovative? The way we go about doing this is we'll screen folks for their clinical skills, and if we feel like they're trauma informed, they have a desire to do this work, they can work with multi-generational families, or they can work with folks from different ethnic or language backgrounds. And then we say to the host agency, here are 3 people you pick. It doesn't matter to us. It's their pick. At that point, we've let go. It does not matter. We may have our preference, and if they ask, we'll tell them. But we're not going to send them anybody we would not be okay with. And so we really can let go and feel confident in their decisions. We feel like it's innovative because I think it's really looking at the community as a whole as opposed to an individual agency. Like, we're not doing this just to strengthen ourselves. We're doing this. I've gone and asked for money just for Martha O'Brien. Help them and help us help them. That's what we want to do. So I think that's important. I think that it really does match with the language around healthcare access and health equity. It's that if healthcare is somewhere you can't get to it, it doesn't exist. So what we're saying is, let's put it somewhere where you don't even go looking for it and you find it. It's often we take more advantage of the things we stumble across than the things that we go in search of. So we want to make it that available to people. It's not, again, it's doing something in a different way. We're doing this counseling we've always done. It's exactly the same work. Let's see. And again, it's going to folks where people are, and it's letting us grow, not where we're planted, but where we're needed. So if you think about us expanding our reach, I don't see us expanding our reach this way. I see us expanding our reach trying to support other folks. And that lets us expand our reach, because we'll never build a big enough building to do everything that's needed. Let us be in your building. Let us be in your part of town, your neighborhood. And if you let us be there, the people who live there will avail themselves to us. If we just come and knock on doors, we're just the people from that building over there. So what we're really asking for is an investment in this larger model that we really feel like is doing exactly, it is fulfilling kind of the command to decrease barriers and get services out there. And we would simply bring that in and add capacity, and depending on what the funding looked like, if it were a full position, that would be great. That's basically what we asked for. If it weren't, then there's still a gain. We would make that work and negotiate that back. So.